Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating and potentially life-saving topic for our canine companions: cranial tibial artery pseudoaneurysms following routine orthopedic procedures. This condition, while rare, demands recognition from veterinary surgeons to prevent severe consequences. We'll be drawing from a recent study that examined two such cases, shedding light on the causes, diagnosis, and treatment of this condition. Our journey begins with understanding what a pseudoaneurysm actually is. In simple terms, it's a false aneurysm resulting from a defect in the arterial wall. Unlike true aneurysms, where all three layers of the artery wall remain intact, a pseudoaneurysm occurs when blood leaks through a disrupted arterial wall into surrounding tissues, creating a persistent communication between the artery and an adjacent cavity. These pseudoaneurysms can arise from various factors, including trauma, inflammation, or iatrogenic causes like surgery. In human medicine, they're a relatively common occurrence after orthopedic procedures. The damage often stems from partial division and erosion of the pulsating arterial wall, frequently due to projecting metallic screws or hardware. While pseudoaneurysms can affect various arteries, the popliteal artery is most frequent in the lower extremities in humans because it is not supported by muscular tissue. Now, let's turn our attention to the cases presented in the study. Both dogs developed cranial tibial artery (CTA) pseudoaneurysms following routine orthopedic surgeries. The first case involved a 5-year-old Gascon Saint-Tangirois who presented 25 days after undergoing surgery for a ruptured calcaneal tendon. The repair involved a 3-loop pulley suture and temporary immobilization with a transarticular external skeletal fixator (TSF). While the initial recovery appeared smooth, the dog was readmitted with acute lethargy, dysorexia, and non-weight-bearing lameness. Upon examination, the veterinarian noted pallor, tachycardia, severe swelling and pain over the tibia, and discolored skin with ecchymosis. A pulsatile bulge was palpated near the most proximal pin of the TSF, with active bleeding from the pin tract. Diagnostic tests revealed a decreased packed cell volume, PCV, and radiographic changes suggestive of a surgical site infection. The diagnostic journey continued with ultrasonography, revealing a well-defined hypoechoic cavity adjacent to the cranial tibial artery. Color Doppler further confirmed the presence of a pseudoaneurysm, displaying a swirling pattern of arterial blood flow, the characteristic yin-yang sign. Computed tomography angiography further characterized the vascular anomaly. The treatment plan involved surgical ligation of the cranial tibial artery supplying the pseudoaneurysm, hematoma evacuation, and removal of the TSF. Bacterial culture identified Staphylococcus pseudoaneurysms, which was treated with antibiotics. Fortunately, the dog recovered well, regaining full weight-bearing ability with no further complications at the 6-month follow-up. The second case involved a 2-year-old Cane Corso who presented a month after undergoing a tibial plateau leveling osteotomy, TPLO. This dog exhibited lethargy, tachypnea, and acute hemorrhage from the surgical wound. Physical examination revealed cyanotic mucous membranes, tachycardia, and a large soft tissue mass over the TPLO site with active bleeding. A pulsatile bulge was also palpated. The dog's packed cell volume plummeted, necessitating a blood transfusion. Ultrasonography revealed a large hematoma and a pulsatile vessel with a swirling blood flow pattern, indicative of a pseudoaneurysm. In this instance, a tibial screw was observed near the pseudoaneurysm. Surgical exploration confirmed the pseudoaneurysm, which unfortunately ruptured during dissection, leading to significant blood loss and requiring another transfusion. The surgeons controlled the hemorrhage by occluding the cranial tibial artery with hemostatic clips and clotting agents. The hematoma was evacuated and a closed suction drain was placed. The TPLO implants were not removed at this time. Enterococcus species was isolated and was treated with an antibiotic. The dog recovered and was discharged. The TPLO implants were later removed. At the 6-month follow-up, the dog had no further lameness or recurrence of the pseudoaneurysm. These two cases highlight the importance of recognizing the clinical signs of a potential cranial tibial artery pseudoaneurysm. These signs can include lethargy, pallor, non-weight-bearing lameness, bleeding from the surgical site with hematoma formation, pain, and a palpable pulsatile bulge. Color Doppler ultrasonography is a valuable diagnostic tool, revealing a hypoechoic cavity adjacent to the CTA with a swirling blood flow pattern. Computed tomography angiography can provide a more detailed anatomical evaluation. The study authors suggest that the pseudoaneurysms in these cases were likely a delayed consequence of the initial surgical trauma. In the first case, the placement of the percutaneous pin during the TSF procedure likely injured the cranial tibial artery. The study mentions research that has evaluated safe anatomical corridors in the canine tibia to avoid iatrogenic damage to neurovascular structures. They noted that pin insertion in the proximal tibia should be carried out from the medial aspect as caudally as possible. In the second case, the injury could have been caused by the osteotomy itself or by overpenetration of a drill bit or screw. The authors point out that a higher positioned osteotomy might increase the risk of lacerating the CTA. They noted that radiography can be misleading in assessing screw length due to the triangular shape of the proximal tibia. The authors highlight the importance of avoiding overpenetration of the drill bit during surgery. They also note that pre-drilling during external skeletal fixator placement has been reported as a risk factor for pseudoaneurysms in humans. Prompt surgical intervention is crucial once a pseudoaneurysm is diagnosed and the patient is stable. While various treatment options exist in human medicine, surgical occlusion of the cranial tibial artery was successful in these cases. In conclusion, cranial tibial artery pseudoaneurysms represent a rare but serious complication that can arise following routine tibial orthopedic procedures in dogs. A thorough understanding of the cranial tibial artery vasculature and meticulous surgical technique are essential to prevent inadvertent damage. Early recognition of the clinical signs and prompt intervention can significantly improve outcomes and prevent life-threatening complications. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.